Welcome back, and once again, I'm here on location at Orthopedic Associates, and I'm now joined with Dr. Mark Wolgin. Welcome.
Thank you.
We're going to talk a little bit about back pain and some different things, but can you tell us what kinds of conditions maybe cause a patient to have neck or back pain?
Well, I think neck and back pain are conditions that everybody is relatively intimately familiar with. I don't know anyone who's never had a crick in their neck or sore back or slept funny or something like that. So it's very common. Really, there's two kinds of conditions that lead people to come and see a practitioner. And I'm not talking about like getting a car wreck or a tumor, but it's either nerve compression because something is pressing on a nerve, which will give you pain down your arm or leg, or it's arthritis, which is wear and tear. And people don't want to hear that they're getting old, but you don't get less gray hair as time goes on. And it's one of those things that, the discs just become less flexible, the joints get a little arthritic, and they can cause some pain.
Okay, and at what point should a patient maybe seek medical care, and maybe what happens if they don't have something treated?
Well, that's really a great question, because I think a lot of people wind up seeing a surgeon too early. I've had people that come in and they've had one day of pain. Now the problem is it's a very subjective condition. When people have severe pain in their back or neck, it rocks your world. I mean, you can't really sneeze or cough or turn your head. Getting out of bed is a pain. And there's a lot of fear involved. People think that there's something wrong.
Right.
And they're very concerned about it. And so a lot of what we do winds up being non-operative, reassuring, and things like that. So one common question is, what's the risk if you don't do anything? The signs of danger that I'm going to look out for are if someone's getting weak, because that's partial paralysis, like if something's pressing on a nerve, or if they're losing control of bowel or bladder, and that would be an emergency, like going to the emergency room kind of thing.
Okay.
And those happen rarely.
Okay, and you mentioned like maybe non-operative. Let's talk about that. What are non-operative care treatments that are available?
Well, non-operative is obviously the not surgical type of things. I often will tell people this is like a restaurant. We have 4 things on the menu. There's medicine, therapy, injections, and surgery. And most people start with medicine and therapy, and in probably 90% of the cases, the problem will be all better by 6 weeks.
Okay.
And I don't have a way to like turn the key and turn it off and make it better tomorrow, but we look for the trajectory and the trend. So if someone's not getting better, or they want to do the next step, or sometimes they've come in and they've had pain longer time, then we're looking at something more aggressive, which usually is some type of injection.
Okay.
And so a lot of times, like I have a model of the spine here.
Okay.
The discs are in the front. This space right here is where the spinal canal goes, and like an epidural injection would be outside of where the spinal nerves are, but it would be within the bone, but not in the spinal nerves. We can block the joints in the back called facet joints, which are a common cause of pain. And there's other non-surgical ways that people can be helped.
Okay, and that patients respond pretty well to the pain management?
Yeah, and it's really relatively low risk. I mean, we're not really changing them in any way that's irreversible.
Okay, great. And then what is the chance that any particular patient seeing you might need spine surgery?
Well, it's really up to them also. I mean, the thing is that anytime someone has a problem and we go to the operating room, you're going to get 1 of 3 results: better, same, or worse. And the chance of being worse is something above 0. Maybe it's 1 in 1,000, but they have to take that risk. And so they have to get to the point where they say, my life is not good this way and I need to go to the next step. And it's really kind of up to them, but I will recommend it if I think it's appropriate to talk about.
What are some of the most common procedures to do in the spine?
That's probably a much larger topic than we have time for right now, but it's really either decompression, removing pressure off nerves, or stabilization. Like if you have a bad disc, you're fusing it together.
Okay. And then how long maybe is their downtime, their visit, and to recover from a spinal surgery?
It also depends. There's some things you see that are advertised as really quick recovery, but they're really minor surgeries too. So, if you do an open surgery, the muscles have to heal back, and, there's all kinds of things like that are consideration.
Thank you for joining us today here on Healthcare Today, and we'd like to thank the staff here at Orthopedic Associates for having us. If you have any questions for these physicians or about something that we discussed on the show today, please feel free to log on to WALB.com/healthcaretoday. We'll see you next time here on Healthcare Today.